Good morning, students. Today's class we will see the remaining portions of pediatric nursing give reasons. So the 11th question, low birth weight babies are prone to hypothermia. Why? In babies, particularly those with low birth weight, the ability to regulate the body temperature is not yet fully developed, making them more vulnerable to hypothermia. Low birth weight babies are those born weighing less than 2.5 kilograms. These babies have higher surface area to volume ratio than babies with normal birth weight, which means that they may lose heat more rapidly through the skin. Additionally, low birth weight babies often have less subcutaneous fat, which helps to insulate the body and keep them warm. So, three reasons. First one, they have the area regulate the body temperature is not fully developed. They have more surface area and they have less subcutaneous fat. The eyes and genitals of neonates should be shielded during phototherapy. Phototherapy is a common treatment for jaundice in newborn babies, which involves exposing the baby's skin to blue or white light to help break down excess bilirubin in the blood. However, the exposure to phototherapy light can be harmful to the baby's eye and genitals. The light used in phototherapy emits high-intensity blue wavelengths which can cause damage to retina and increase the risk of developing cataract. In addition, the light can cause burns or skin damage to the baby's genitals. Because of these reasons, the eyes and genitals of neonates should be shielded during phototherapy. Head and elevation should be given for a patient with gastroesophageal reflux disease. The GRD is a condition where stomach acid and other content flow back into the esophagus, causing symptoms such as heartburn, regurgitation, and difficulty in swallowing. The head and elevation refers to raising the head of the bed to an angle of about 30 degrees, which can help to reduce likelihood of stomach contents flowing back into the esophagus. This is because the gravity can help them to keep the stomach content in the stomach, reducing the pressure in the lower esophageal sphincter, which is the muscle that prevents stomach acid from flowing back into the esophagus. That is why head and elevation should be given with a child with GRD. Oral rehydration solution is recommended for a child with diarrhea. Diarrhea is a common condition in children characterized by frequency of loose or watery stool. It can lead to dehydration, which is a serious complication that can occur as a life-threatening if it is left untreated. ORS is a solution of salt, sugar, and water that is specifically designed to replace the fluids and electrolytes that are lost during diarrhea. It helps to prevent dehydration by replacing the fluids and electrolytes that the body has lost. ORS is recommended as the first-line treatment for diarrhea in children regardless of the cause of the diarrhea. It is safe, effective, and easy to use and can be given at home or in a healthcare setting. The next question, edema in children with nephrotic syndrome. Nephrotic syndrome is a common condition characterized by excessive protein loss through the urine, which leads to low levels of protein in the blood and edema in various parts of the body. The edema thought to be related to the changes in the way the kidney filter the fluids and electrolytes. When the kidneys are not functioning properly, the fluid can accumulate in the body, which leads to edema. Edema can occur in hypoproteinemia because of decreased levels of protein in the body, especially albumin in the blood. Proteins in the blood, particularly albumin, play an important role in regulating the movement of fluid between the blood vessels and surrounding tissue. When albumin levels are low, fluid can leak out of the blood vessel and accumulate in the surrounding tissue, leading to edema. Next question, headache in child with meningitis. Meningitis is an infection of meninges, which is a protective membrane that surrounds the brain and spinal cord. When the meninges become infected, they can become inflamed, which can cause symptoms such as headache, fever, and stiff neck. In children with meningitis, the headaches may be severe and persistent and may be accompanied by other symptoms such as nausea, vomiting, and sensitivity to light. The headache may worsen with moment of changes in position and may be described as a throbbing or pounding sensation. Next is prone position for a child with meningomyelocele. Meningomyelocele is a birth defect in which the spinal cord protrudes to the opening in the spine. In supine position, the pressure on the spinal cord can worsen the condition and lead to complications such as paralysis, spinal deformities, and bladder and bowel dysfunction. That is why the prone position is preferred for a child with meningomyelocele. Administering insulin for a child with diabetes should be done before giving the food. Why? Administering insulin before meals helps to ensure that insulin is available in the bloodstream when the body begins to digest food, which can help to prevent high blood sugar level. If the insulin is administered without food, it can lead to a drop in blood sugar, that is hypoglycemia. This because the insulin helps to move the glucose from the bloodstream to the body cells where it is used for energy. When there is no food in the system, the glucose levels in the bloodstream may drop too low, leading to hypoglycemia. That is why we should ensure the food is available before we give the insulin to the child. Acute pain in child with otitis media. Acute pain in child with otitis media caused by inflammation and buildup of fluid in the middle ear. Middle ear is located behind the eardrum and normally filled with air. However, when the eustachian tube, that is the tube connects the middle ear to the back of the throat, becomes blocked or swollen, it can cause a buildup of fluid and pressure in the middle ear, leading to inflammation and pain. In addition, the inflammation and pressure the infection caused otitis media can also contribute to the pain. The infection may cause the eardrum to become red, swollen, and inflamed, leading to discomfort and pain. The next question is, babies of diabetic mother are prone to get hypoglycemia. Why? Babies born to the diabetic mothers are at risk of hypoglycemia or low blood sugar levels because they may have been exposed to high levels of insulin in the uterus. When a pregnant woman has diabetes, more glucose transferred to the fetus, and fetus may produce high levels of insulin to manage the blood sugar level. Babies of diabetic mother may have difficulty regulating the blood sugar after the birth because the pancreas may continue to produce high levels of insulin in response to the elevated blood sugar levels they were exposed in the uterus. But when the cord is cut and clamped, the supply of high glucose from the mother will be stopped. So, the pancreas is continuously producing high levels of insulin. So this can lead to a sudden drop in the blood sugar level after the birth. Thank you. Thank you for listening.